20 signs of diabetes you've never heard of before. Reactive hypoglycemia is not something doctors talk about often. I will explain it later. Diet and lifestyle can reverse early diabetes definitively. There are many overlooked symptoms that can give you an early warning. Spotting these signals early lets you take action before diabetes takes over. I have had diabetes for 43 years. Even at the pre-diabetes level, there is an increased risk of serious long-term complications. These include heart disease, stroke, kidney disease, and vision problems. I regret not controlling it well in the early days. Number 1. Quick weight loss for no reason. When the body can't use insulin, it starts burning fat and muscle instead of glucose. You may lose weight fast, even while your eating stays the same. Type 1 signs could be a bit different, but you can get type 1 at a later age as well. The most common first signs of type 1 diabetes include increased thirst, frequent urination, sudden weight loss, and extreme fatigue. These symptoms can appear suddenly and are caused by the body's inability to properly regulate blood sugar levels, forcing the kidneys to work overtime. Other signs can include blurred vision, increased hunger, and even nausea and vomiting. Number 2. If you have high BMI, check for diabetes works more often. The higher your body mass index, the greater your risk. People with BMI over 25 should test for diabetes every 3 years starting at age 35. Indians and other people with darker skin need to target a BMI less than 23, according to some new research. Number 3. Frequent mood swings. Blood sugar spikes and drops can affect your emotions, leaving you irritable, anxious, or moody. These swings often settle down when blood sugar returns to normal. Irritability can be a symptom of prediabetes because the brain relies on a steady supply of glucose for optimal function, and fluctuations in blood sugar levels can lead to mood changes. When insulin is less effective, cells struggle to use glucose for energy, which can cause fatigue and irritability, as well as other symptoms like anxiety, difficulty concentrating, and brain fog. If you experience persistent irritability or other prediabetes symptoms, it's important to consult a doctor to discuss your concerns and get an accurate diagnosis. Number 4. Frequent toothaches and dental issues. Diabetes weakens the immune system and reduces blood flow to your gums. High sugar levels help bad bacteria thrive, causing tooth decay, gum disease, and infections. Prediabetes increases the risk of common oral issues like periodontitis, gum disease, and tooth decay due to the effects of higher blood glucose levels. Poor glycemic control in prediabetes makes individuals more susceptible to infection and inflammation, which damages gums and can lead to tooth loss. Conversely, having periodontitis can worsen glycemic control, making it harder to manage blood sugar. Maintaining healthy lifestyle habits like a balanced diet, regular exercise, and consistent dental care, including brushing and flossing, significantly improve situation. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 5. Recurrent infections. High blood sugar makes it tough for your white blood cells to fight off germs. This means more frequent coughs, bladder infections, skin infections, and illnesses that keep coming back. Number 6. Hunger even after eating. When your cells aren't getting glucose, your body thinks it's starving, even when your blood is packed with sugar. You feel hungry all the time as a result. Number 7. Urination increases, especially at night. Your kidneys work hard to filter excess sugar. When they struggle, extra sugar spills into your urine, taking fluid with it, so you pee more often. Number 8. Dry mouth and thirst. Urinating a lot leads to dehydration. The body uses fluid for urine, so your mouth may feel dry and sticky. Number 9. Sweet or fruity smelling urine. Sugar from the blood spills into urine, causing a sweet or fruity smell. Some people notice this before any other diabetes symptoms. Number 10. Blurry vision, especially after a heavy meal. Diabetes affects every part of your body, including the eyes. High sugar levels change fluid balance, causing blurry or distorted vision. Number 11. persistent fatigue. Your body isn't getting the energy it needs because glucose can't enter your cells, so you feel tired even after rest. Number 12. Pins and needles, numbness, high sugar damages, nerves often in hands and feet. This leads to tingling, numbness, or a burning feeling. This can signal underlying conditions like diabetes, vitamin deficiencies, a pinched nerve, autoimmune diseases, or toxin exposure. If the sensation is persistent or frequent, it's important to see a doctor for a diagnosis and treatment. This condition may be caused by diabetic neuropathy. Number 13. Dark, velvety skin patches. These show up around the neck, armpits, or groin, a condition called acanthosis nigricans, visible mainly on white or fair skin. They point to high insulin levels, and doctors often use this sign to spot prediabetes. Number 14. Sexual dysfunction. Diabetes damages the nerves and blood vessels that are necessary for sexual function. It can lead to problems with erections in men and reduced sensation and dryness in women. Number 15. Reactive hypoglycemia. After a meal, blood sugar goes up, but your pancreas is late to the party and makes insulin a bit later. Blood sugar drops too low a few hours after a meal. So, blood sugar goes too low. You feel shaky, dizzy, or sweat a lot. This can mean your body is becoming less sensitive to insulin. Number 16. Yeast infections. Yeast eats sugar, so high blood sugar causes more yeast growth, leading to frequent infections in the mouth or genital areas. Number 17. Fruity breath. If your body can't use glucose, it starts to break down fat instead, releasing acids called ketones. These give your breath a sweet or fruity odor, which can be a warning sign of serious problems. Number 18. Nausea. If high sugar levels damage nerves in the digestive system, food moves slowly out of your stomach. You may feel sick and even vomit. Number 19. Lightheadedness, fatigue, or hunger. All these symptoms can be caused by swings in blood sugar. Dehydration from frequent urination and the body's need for energy both contribute. Number 20. Itchy and dry skin. Damaged blood vessels and poor circulation mean less moisture gets to your skin, causing dryness and itching. Good news for people who catch diabetes early. Research shows that 58% of people with prediabetes stop the disease in its tracks by making simple changes. People over 60 had a whopping 71% success rate reversing prediabetes. In just 1 to 5 years, about half of people with prediabetes can return to normal blood sugar levels with the right steps. The recipe for success includes losing 5 to 10% of body weight, getting 150 minutes of exercise each week, and swapping processed foods for real balanced meals. Early diabetes doesn't have to become a lifelong burden, but action works best when you spot the warning signs and do something quick. Every month you wait makes reversal harder. Take charge when your body gives you these early signals. Please click the like button and subscribe if you think this video is useful. On the screen you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.